Hello, welcome to our Tuesday talk. What I may do for our next series of talks, I'm going to get common questions that I get asked on Real Self and maybe address some of those things that are commonly asked, so we have access to those. But as always, please, if you have any specific questions you want me to address, just leave a comment. We check those and I'll be happy to address those on a future talk. So today we're going to talk about one of the common things we ask is, should I have liposuction? Should I have a tummy tuck? And why do you pick one over the other? Because that's a critical distinction and sometimes a very hard thing for patients to come to terms with when they come in thinking, I want liposuction, but really need or would benefit more from having a tummy tuck. So what do each of these things treat? Okay, well, liposuction removes fat, okay? And that's what it does. It just simply removes fat, okay? Whereas a tummy tuck, you're gonna get several things. You're gonna remove fat from the area where you're also removing skin. So it's gonna remove skin and fat, okay? So if you have loose skin, it helps with that. Plus it also tightens up your muscles. Well, why would you need your muscles tightened? We're going to get into that in a little bit. Okay, so who's the ideal liposuction patient? The ideal liposuction patient is somebody who has an area where they have extra fat. For example, I can lose weight, I get really thin, but I carry extra fat right here on my sides, or right here on my tummy, or on my thighs. And no matter what I do and what weight I get down, I always have the stubborn area. That's an ideal patient, provided they have good quality skin. That means the skin still has to be elastic. People who are not good candidates for liposuction are people who typically have gone through pregnancies, even though they may have extra fat. If the skin's been stretched out because of from pregnancy or just from carrying weight for a long period of time, they're not going to respond well to liposuction, because with liposuction, see, if you got skin and you got fat, and if you take fat away because you do liposuction or you go on a diet or you have a gastric bypass surgery, that skin has to be elastic enough to shrink up to the new you. And if it's not elastic enough because it's been stretched out for too long, it's not going to work. Just like you've seen people on TV, they've gone on The Biggest Loser and they've lost 100, 150 pounds and they're thin and they look great, but then have that hanging skin from their arms, their belly, their neck and whatnot. Okay, so that's the people who don't really benefit from liposuction. Yes, if they have extra fat, can you make them thinner? Yes, but you're never going to get rid of the loose skin. So who's the ideal tummy tuck patient? The ideal tummy tuck patient is somebody who has extra skin, okay? They may or may not have extra fat, and if it's just in the lower part of their abdomen where you have the extra skin and you're going to be removing that skin, you could also remove that fat at the same time. If they have extra fat in the upper part of their abdomen on the sides where you're not going to be cutting out skin, then a tummy tuck alone won't help those patients. And also people whose muscles have spread out, either they were born that way or through pregnancy. You know, when the belly gets bigger, the muscles which start here in the middle, they spread apart. And after pregnancy, they don't snap all the way back in the middle, so they're a little bit spread. And sometimes when you're doing like a sit-up, you can feel that space between the muscle, you feel that ridge, or your belly pooches forward a little bit, and you have to hold your belly tight to keep it flat. Even though your weight is the same after pregnancy, your body's been changed. So that's what really a tummy tuck is going to address. It's going to address loose skin or extra skin, extra fat in the lower part of the abdomen, and loose muscles. All right, now we're going to talk about who benefits from having a combination of those surgeries, okay? So we already talked about who benefits from a tummy tuck, but those patients who would benefit from a tummy tuck, and say they carry a little bit of extra fatty tissue in their upper part of their belly or in their flanks, areas where you're not going to be cutting out extra skin, you can still treat those areas with liposuction, treat the extra fat there, and then still remove the extra skin. So those are patients who might get good benefit from having a combination of those surgeries. Now, we're going to talk about in future episodes, maybe how do we decide what type of tummy tuck. We'll talk about all sorts of things, maybe how to determine between a breast lift and a breast augmentation or both. So those are going to be future topics, but of course, anything you want me to discuss, I'll be happy to do it. And if you have any questions about these procedures and would like to see me and talk about them in person, just please call my office or reach us through the website and we'll be happy to meet with you. Thank you.